Hello attendees. I'm Pauras, my pronouns are he, him, and I'm a third minor MBBS student in St. J.S. Medical College in KM Hospital, Mumbai. Today, it is my pleasure to welcome you all for this webinar organized by me. And we have with us a very esteemed speaker for today. We have Dr. Nehar Rajapurkar, sir, who is a student of 2016 batch of St. J.S. Medical College and KM Hospital, Mumbai. He has scored an All India rank of four in INI-CET May 2022. So congratulations from the behalf of all of us. And before we begin, I would like to mention a few instructions for the attendees. Uh, I will request everyone to keep your mics muted, that is turned off whenever you are not speaking, or, and whenever anyone else, either a speaker or other attendee, is actively speaking. I mean that don't interrupt others unless absolutely required. However, you are encouraged to turn on, that is, unmute your mics uh, during the Q&A slot if you have any question. Videos could be kept on or off according to choice and convenience. Inappropriate words like abuses, harsh, or rude words towards anyone in the meeting or outside, either through audio or chat section, is strictly prohibited. Any such instance will lead to removal of the attendee from the meeting. And as stated above, like previously, some time at the end is allotted for audience questions and doubts in the Q&A slot. If you have any question during the webinar, we request you to note it down so as to ask it whenever the time is given. The question could be asked either by turning on your mics and asking it yourself, which is preferable, or you can also use the chat box for the same. I also welcome our attendees who are watching this webinar through the YouTube live stream. If you have any questions, you can put it in the comment section, like live chat section of the YouTube live stream, and those questions will be asked in the Q&A slot. With this brief introduction, and without any further ado, I hand it over to Dr. Nehar to conduct the session. Thank you.
Okay, thank you. Thank you so much, Pauras. So let's start with the session. So for my introduction has been given by Pauras. So what I'm going to do is I am going to give you some advice which I have generated during my PG entrance prep. So it would be kind of a guidance session. So this session, the way I'll go through it is that I have divided into various steps. The first step is how to start. At if you are at any stage of your preparation, how do you start from that stage? The second step would be what materials should you use to prepare for the PG entrance exam. Third step would be where should you practice the MCQs from, because of course MCQ practice is very important because the exam is in the form of MCQ. And the last but not the least, I'll give you a brief about the various examinations which are being conducted today. What are the layout of the examination and what are the tricks you can use to crack these examinations. Now, the first step out on how to start. So I have divided this this question. I have divided into the following scenarios. So, for example, if you are someone who has just joined MBBS, or you are a second year MBBS student who has just cleared his first year, and you are thinking about preparing or starting to prepare for a PG entrance, my advice to you would be to chill, focus on enjoying your college life. At the same time, focus on building concepts, because first and second year are the most crucial year where you build your concepts of medical sciences. So spend your time building your concepts and knowledge base, and you can also read first aid for step one once, which we'll discuss in the further slides. If you are in third minor MBBS who has recently passed in second year, this is the time. This is the ideal time where people start with their PG prep. So here, your first step should be to choose a primary source and aim at spending your first 2 years if you feel that you haven't been able to do so. Read the third minor subject, because of course you have to give your prof, and try to finish at least one final year subject and three minor subjects. And of course, read first aid once. If you are in your final year, your main focus should be on your professional exam, because final year is very daunting. It's actually very difficult. And basically, what you can do over here is, whenever you read a certain subject for your professional, like final professional exam, you can also read the subject from the MCQ point of view. And if you are in your internship, I'd suggest you join a TND course, TND course, and read the subjects according to a timetable given. So these TND courses, they have a timetable given on which date they are going to conduct which test. So you read your subjects according to that, and also read first aid once. Now, about the materials to use, my first advice to everyone would be to beware of something known as FOMO, which is fear of missing out. So basically, nowadays there are a lot of materials, a lot of apps, and a lot of teachers like in the uh, on the net and in the market. So basically, uh, because one student is using material A, other student is using material B, so we tend to get very distracted towards using many materials. So the disadvantage of this is that if we use a lot of materials, uh, we tend to revise less, and that's why we feel that some subjects are weak. It's not like these subjects are weak, but the problem is that we have done them from multiple materials. So my first advice to you would be to beware of something known as FOMO. Don't get caught into FOMO. Stick to a certain primary material and go by it. Now, about the material to use, I have divided into two parts: the source materials you can use and the materials for rapid revision. Now, the source materials I've kind of differentiated between dams and marrow, which are the ones which I use. And of course, dams and bhatia are like equivalents of each other, while preplata is the equivalent of marrow. So in dams, the lectures can be live or pre-recorded. So the thing with live lecture, it helps you to maintain your discipline, but because you write notes as the teacher is dictating them, so you don't miss on anything. But at the same time, since these lectures are like 12 hours long and on a weekend, these are very tiring. While Marrow, since the lectures are pre-recorded, they allow some flexibility in your schedule. But at the same time, you tend to procrastinate a lot because you know that these lectures are not going anywhere. So you tend to waste a lot of time. The notes in dams, wait a minute. Yeah. So the notes in dams, they are high yield and they are very specific. So the thing is, you can revise them a multiple number of times. But since the content given in these notes is very limited, these notes are like very specific. It is very difficult to use these notes to build concepts. While Marrow notes, they are in depth and they are thorough, and so like they are best for understanding a particular subject and forming concepts. But the problem is, since the content is very vast, it is very difficult to it is very difficult to revise. Now, the next thing even though I had used dams and marrow, like with the pros and cons, there are like differences, and differences between these two resources. I'd say that you choose them according to your comfort, but there are certain resources which I feel are better for specific subjects. For example, marrow is a preferred subject for is a preferred source for surgery and biochemistry, while DAMS is a preferred source for medicine and short subjects like skin, anesthesia, radio psychiatry, and ortho. Now, about rapid revision, the most important thing is to read first aid once. So basically, it's a must-read book for a student at any stage in the preparation. So it's a book which is usually used for people who prepare for the step one exams, but they can also be used for PG entrance prep also, as they cover first year, second year psychiatry and biostatistics. Like more than half of the subject gets covered if you read first aid thoroughly. So the way you can approach it, since the book has 800 odd pages, if you try to do 10 pages per day, you can cover this book comfortably in 3 months. So that is my advice for first aid. Now the second thing is there's something known as DAMS visual treat. So basically, the DAM faculty takes a 6-day course of rapid revision every year, and the notes from this course, they are very high yield. So basically, what I did, I in the days before my exam, I revised them multiple times. So my advice to you would be to see only the one which they conduct before your exam. For example, if your next exam is going to be in 2023, you see the DVD 2023 and do it thoroughly once before the exam. Now the last rapid revision source which I found, like just the month before my exam, was an academy lecture by Dr. Zainab Vora. So basically, she has done three review series. First is Midnight Express More, in which she has covered like 5 high-yield topics per lecture, and there are like 65 of these lectures. So what I used to do, I used to look at see them at 2x during my free time, and they used to be a good revision resource. The second thing is BTR, which is a series of lectures which she has done for volatile topics. So, like on her Telegram group, she has a PDF of all those 9 lectures, and you. My advice to you would be to see the PDF once before the exam because they cover the volatile topics. And there are 2 more courses, which is rapid revision and crash course, which she has done for specific subjects. So I'd suggest that you do it only for the subjects you are weak at. So now about where to practice MCQs from. So there are like 5 sources which I where you can practice MCQs: QBank, PYQ, Grand Test, TND, and Mock Test. So now about QBanks again, my advice to you would be to use Maro over DAMS because Maro has a better UI and in-depth explanations. While previous year questions, again the advice again the advice in this would be to do them once or at least twice or thrice before your exam, because if the question comes as a repeat, it's easy marks, and if you make a repeat wrong, that your rank gets affected a lot. And how many PYQs to do for NEET? I'd suggest you do 3 years PYQs, while for INI-CET do past 5 years PYQ. Also, if you have time, see the last 3 JIPMER, PGI, and enhanced papers, which are available on the DAMS eMedicos app. Because this year I found out a lot of questions were also in this INI-CET were also repeated from the previous year JIPMER and PGI papers. For practicing PYQ, you can either use DAMS or Maro. So basically, DAMS has given the explanations in the form of videos, while Maro has given the explanation in the form of text. So the way you want it. And basically, whenever you're doing previous year questions, don't try to memorize the answers or memorize the option that was the answer. You should focus on the concept, because even though the question per se might not be repeated, the concept does get repeated and it will get repeated. And there is one more feature which I found to be very useful in Maro is schema. So basically, they have a list of important topics or subtopics which get repeatedly asked in PG entrance exam. So you can go through that list once to see which topics you have done or not. In DAMS, the GT difficulty is usually moderate, while in Maro it can be variable. Sometimes the GTs can be too easy, and sometimes the GTs can be too tough. And what I have realized that the INI-CET paper pattern is very close to DAMS grant test, while the NEET PG paper pattern and the ways they ask questions in the NEET PG paper, with consideration to the latest one, which was taken the last Sunday, Maro closely mimics NEET PG. Now about how to approach grant tests. So there are 2 approaches. There is one learner approach and there's one test taker approach. So I suggest you go for the learner approach if you are in the initial part of your preparation. For example, if you are in your third minor or final MBBS, the way you go for it is that you give a grant test and you see all the explanations. There are 200 questions, there are 200 explanations. You go through all the explanations and learn the concepts from these explanations. Here, you should not worry about the scores or the mistakes you are making. And the positive point of this approach is that it will help you to cover the important topics, but the downside is that it's very time consuming to if you're using the learner approach, you take like at least 2-3 days to cover one GT, while if you are in the later parts of your prep, like you are in internship or you are thinking of taking a drop, so you go for the test taker approach where you give the GT as a test and only see the questions you have done wrong or the questions you have guessed, so as to identify your weaknesses and rectify them. So this helps to minimize your mistakes, but the problem is here the output is less. You learn less from this approach, but you are able to correct yourself and avoid like losing your marks from this approach. So now about the TNDs, when to join a TND, join it during an internship, and I'd suggest if you are thinking of doing a T&D course, do it from DAMS. About mock tests, so basically mock tests are special tests which mimic the exam. I'd say that if you are thinking of giving a mock test, give it properly, like on a give it properly, like on a PC, so that you can PC and produce the exam environment. Since the exam is taken in a room which is full of ACs and cubicles, you can give it like in a similar environment. And when to start giving mock tests, I suggest to start giving mock tests 2 months before the exam. How many mock tests should you give? You should give one 2 months before, the second one month before, and the last one 2 weeks before. And basically any mock test you approach, you should approach it using the test taking strategy, where you should review only the guessed or correct answers. Don't try to go through the whole mock test. Now about approaching to the MCQ, I found out that a proper approach to the MCQ is very important, because uh, approaching the MCQ properly will prevent something known as silly mistakes, and which are the main factors in determining one's rank. Now, my first advice would be to always read the first line, last line properly, especially if it's a lengthy case scenario, which is the norm nowadays. Then read the complete question and understand what the question is trying to ask, and then read all the options with the intention to eliminate, and then choose the right answer. So basically, whenever we approach an MCQ, our aim should not be to choose the right answer. Our aim should be to find the three wrong answer. So whenever you read the options, you think why this particular option could not be the right answer, or why the option you think as the right answer is the right answer. Then when should you leave a question? Because these exams have negative markings, you should leave a question when you cannot eliminate any option, or you can eliminate one option. So basically, if you eliminate two options, you have a 50% chance of getting this question right or wrong, which are favorable odds. If you eliminate only one option, you have a 66% chance of getting the question wrong, which is kind of an unfavorable odd. And if you haven't eliminated any option, you have a 75% chance of getting the question wrong, which is also an unfavorable odd. So if you can eliminate at least two of the four options, you should go for the question. Now the exams. So here I've tried to cover the INI-CET and NEET exams. About the pattern, INI-CET exams, the questions are a mixed bag pattern. There are direct questions. There are questions which are of multiple completion types, match the following types, arrange in the order types. But at the end, all these questions, they ask for a single correct option. So basically, the pattern of these questions varies, but the type of the output the question asks from you is the same. Basically, it asks you an MCQ at the end. While in NEET, the questions are mainly direct Q&A questions. The questions in both the tests, the questions are now the same. Both of them have 200 questions. The negative marking, INI-CET, the negative marking is a little more, which is 1/3 against 1. While in NEET, the negative marking is a little less, which is -1 against +4. The difficulty, INI-CET asks questions from a limited set of topics, which are called as pet topics. But the questions which are asked, they are asked in depth, and they have a confusing option. They have confusing options, which makes it a lengthy paper. While in NEET, the question can be asked from any topic, and only superficial knowledge is required. And the question and options are literally straightforward. Even though, like in NEET, the questions can be asked from any topics, it is very prudent to do to be sure with all the topics which come as IMPs in the university exams, because the NEET questions are made by faculties who are practicing medical colleges or who are in universities. So it's a good practice whenever you are giving your profs also to do the IMT topics from the MCQ point of view. About the timing, the NEET gives you more time to solve the paper, which is 3.5 hours, while INI-CET gives you only 3 hours. And as I discussed, INI-CET is very similar to a DAMS GT, while NEET is very similar to a Marrow GT. About rough work, in INI-CET, rough work is allowed, while in NEET, rough work is not allowed. Basically, you have no pen and paper. And one more important point which I wanted to talk about is about questions marked for review. So as you might have done in your UG entrance examination, there are certain questions you can mark for review. Is basically you have a doubt in the answer of this question, and you want to come back to it later on. So in INI-CET, questions marked for review are not considered for evaluation. So basically, if you mark for review a question and then the paper gets submitted, that question would be left as unmarked. So what my strategy is to not mark for review any question in INI-CET. Since you have a paper for rough work, just to write the number of the question, just write the number of the question on your rough work sheet, and you can come back to it again once you have done the paper once. In NEET, the mark for review questions are considered for evaluation, so you can liberally mark all any question you have a doubt of for reviews, because that question at the end would be considered for review. So now the approach to the exam, what I feel is that your first reading of the question paper or the whole exam should be your best reading. You should try to mark the right answer in the first reading onwards. Don't leave any question for review, and don't be in the pressure that since you want to review, you won't give much time or effort in your first reading. Now then, reviews, ideally I feel that you should go for one review, but two reviews are the best. Now in the first review, you should always try to justify the wrong options and try to justify the answer, while in the second review, just try to summarize the question and check the answer mark. So like I discussed this strategy using a sample MCQ. So this is a previous year NEET question. So so as you can see, this question is a case-based question, which is the norm nowadays. So the first thing which I do while approaching this question is to read the last line. Which of the following lymphatics will typically receive the cancerous cells from the anal tumor? So as you can see, since I have read the last line here, I know what the question is. I don't need to read the whole case. Basically, this question is asking which lymph node drains the anal canal. Okay, and then for completion's sake, I read the whole question. Like there's a 53-year-old man who comes to the OPD because of abnormal mass developing in the anal canal. A biopsy shows SCC, and again there's no extra information which I need to answer the question. Now I look at the options with the approach of ruling them out. So option A is the deep inguinal lymph node. So what I know that the deep inguinal lymph node drains the lateral aspect of the foot, and it drains the back of the calf, and it drains the superficial inguinal lymph node. But nowhere it is said that it directly drains the anal canal. So that would be an incorrect answer. Superficial inguinal lymph node, we know that it drains everything below the umbilicus, all the superficial, and since it's superficial, it drains the superficial structures. So that could be the answer. Internal iliac, since it is along with the internal iliac vessels, it would drain the pelvic organs, which are supplied by the internal iliac artery. And anal canal is not a pelvic organ per se, so that won't be the answer. Para-aortic nodes, as we know, they drain the testes in a male. So again, that's not the answer. So the answer will come to is superficial inguinal nodes. So this was my first reading of the question. In the second reading of the question, I'll just see, okay, this question was asking me for the drainage of the anal canal. So deep inguinal lymph node I ruled out because it is deep, it's not superficial. Superficial inguinal lymph node was the answer because anal canal is a superficial structure. Internal iliac lymph node is not the answer because internal iliac drain pelvic organs. Para-aortic node, since it drains the testes, it's not the answer. So like the answer was superficial inguinal lymph nodes, and what I wanted to focus on was reading the last line first, and always knowing that you always, and like the importance of knowing that you need to rule out the other options before coming to the right answer, so that you avoid to the maximum extent that you avoid silly mistakes, which are the ones which determine your ranks. So now, like the last but not the least, which I wanted to discuss was how to manage your PG prep with internship. So my first advice to all the upcoming interns would be that internship is a learning experience. Don't waste it. Whatever you learn during internship is important for you as in the future as a doctor, and also it is important for you in the PG entrance exam. For example, there are certain things that you learn during internship, like how to put a NG tube, how to put IV lines, what are the color codes of the IV lines, how to perform an ABG. which are the same questions which are asked in the NEET PG or INI-CET exams. Like in the previous years, the pattern has been to at least have 2-3 questions of internship related procedures in the exam. So don't waste the experience. Treat it as a learning experience. Now, second thing, don't try to overwork. So basically, if you are doing your internship in a government colleges, the work will be a lot. And since you are a newly graduated doctor, you will be under the impression that I need to work I need to do a lot of work. So my advice to you would be just do the work which is assigned to you, and then use the rest of the day to study. Don't try to work overtime. Then consistency is important and quality is important over quantity. So basically, in internship there would be days where you have done a night shift and you can't can't study. It's okay. Basically, try to take out time every day, even though it is very less, an hour or two, to study, but try to study properly during that time. So basically, try to study every day, even if it's a little amount. Try to take out times to study, and that is what adds up in the end. Now, again, as I have repeated in the previous point, like go easy on yourself. If you are too tired on a certain day to study, take a break. Take a break for that day, so that you get recharged and you can work more the other day. Then uh, my last advice to you would be to find a study partner. So a study partner who also wants to uh, prepare for the PG entrance exam. So like what you can do in this case is that you can read different topics and teach each other those topics, which would save you a lot of time. And also there are certain things that the other person might understand better, and there are certain things you might understand better. So you might be able to complement that by teaching each other. Now, and then the last point is that try to best utilize the light postings. So light postings, they vary from college to college, which these are postings where you don't have to do a lot of work and you have a lot of free time. So don't thinking of it as a light posting. Don't try to waste that time. Try to study extra or try to study a heavy subject during that time. For example, when I had heavy postings, I used to study a short subject because I used to get less time. And when I had light posting, I used to try to cover like 2-3 long subjects because there was a lot of time. So like that's my advice on how to prep with internship. Like time for the Q&A session. Okay.
Thank you so much, Dr. Nehar, for your wonderful guidance, like step by step guidance, and your points for each and every step of preparation was really wonderful. Now I request whoever has doubts or any questions to please unmute yourself and ask, or else maybe put it in the comments. Sorry, put it in the chat box if you're a bit hesitant to turn on your mics. And the YouTube live stream viewers can put it in the live comment section as well. Thank you. Uh, Also, we tried to cover many questions which were asked through the Google registration form. Uh, However, the remaining questions could still be asked if those any of your questions were not answered.
I hope I'm audible.
Yes.
Yes. So, good evening, sir. My question was that suppose we shift to dams in the third first, as you said, that up to in the second year, a lot of people do take Marrow, but that is mostly for concept building and reading and those purposes. But once we shift, what about the first 6 subjects? Which notes do we use, or is first aid enough for those 6?
I think first aid is in pretty much it's enough for the 80% of the first week. So what I feel that the approach should be that you use first aid to revise the basic content of those subjects, and like whatever previous year questions you come through, like which have new concepts or whatever, like questions you weren't able to solve in your GTs, like the extra stuff from that you can annotate in your first aid. So that is how you can use first aid in your third minor.
And, and sir, what about the like from what third minor onwards? So in case surgery, so if I've done marrow, I'll use those notes. If I've done dams, I'll use those notes. Is that how that works? Like whatever app I use or whatever source I use, those notes would be the final one.
Uh,
Is
I
that
I believe that yes, that should be the practice, because whatever you have read, if you are going to read it the second time, it would be much easier than reading something new. So if you have started with one resource, I'd suggest you stick to it till the end, because it becomes much easier to read the same thing multiple times, which kind of increase your retention and the yield from that. Rather than reading like from 10 resources, I'd suggest you read from the same resource 10 times.
okay? Thank you, sir.
Welcome.
Thank you, Maurya, for your question, and thank you, Dr. Nehar, for answering. We have a question in the we have few questions in the chat box. First, I'll ask the question asked by Pranav Doshi. He's asking whether is it advisable to prepare for USMLE and next board, and if yes, how should we do it?
USMLE index. Uh, so basically, since next is going to mimic the USMLE pattern, I don't feel that there is going to be a difference between the preparation for USMLE and next. You can use the same resources, but again, like for what I feel that for USMLE you need to dedicate some time in solving U world. So you should see how you are able to manage that. So like, but at the end the resources are the same. You can use first aid for both.
So actually, I wanted to ask that for USMLE, most people suggest that we should see Kaplan videos, and for next, many people say we should see Marrow videos. So if we are preparing for both, then what should be our approach?
Okay, so like what you can do in this case is that in USMLE the focus on the question is mainly of a conceptual one. So like if there are conceptual subjects like pathology, physiology, and pharmacology, you do it from the Kaplan videos. But then there are certain theoretical subjects like anatomy, microbiology, which are not covered that in depth in first aid. So for that you can use Marrow videos. So you can use a combination of them. For building your concepts, I feel that Kaplan videos is the best. But if you want in-depth and thorough revision of that subject, then Marrow videos are better.
So
Okay,
continuing
thank you,
on
sir.
the similar lines, if we were to give step two, so like is INI-CET preparation would it benefit us for step two, or for we cannot or we should not give it at the end of internship? Say we have given the INI-CET and then we want to give the step two. So what could be done?
Okay, so like the thing is that for step two, your main resources you world notes, which you world or you world note, which you can find on the web, and like you world has around 3,000 questions. So if you are giving step two uh, with the mindset that you want a good score, and you want to go to your US to do residency, I'd suggest you avoid. But if you just want to pass it for fellowship, then you can do it. You can. I feel that you can give 2 months to it, and you can like get a decent score like a 240 plus.
Thank you so much, sir.
Next question we have uh, asking how can I start preparing from the second year itself? What should be my approach? And can you please repeat if I missed anything?
So basically, as I covered during the presentation itself, I'd suggest that you chill during your second year, enjoy your college life, like take part in some events and all, but make sure that you give time to strengthen your concepts of basic sciences, because these are like the concepts uh, which people tend to forget a lot in their internship. So it contributes a lot between deciding the rankings of the uh, entrance exam. So I'd suggest that you spend more time on developing the concepts, and also as I've discussed in the PPT, you can like finish first year once if you're in your second year, like finish reading it once. That's yeah.
Thank you so much. The next question by Chinmay is in the final year, is it possible to give DAMS TND as well as study for university exams?
Uh, bas- Basically, the you can, but what I feel that since final year, your main aim should be to go for university. I feel that you should focus on university exams. TND should be better. It is a better idea to give a TND during your internship, because that is the time you want to revise all your subjects. So like in final year, you should focus on your exams only. And if you're still, if you feel that you would be wasting time, like your PG preparation time, what you can do, you can read those subjects from the PG point of view. So, for example, if you are reading reading a subject like medicine or surgery, so you can at the same time you read them from the PG point of view, so that your MCQ part also gets covered. So TND is to be better done in internship.
Thank you so much. The next question by Nandini is how important are the reference books in the final year for NEET preparation?
Uh, so basically about the reference books, what I felt that these are very low yield, because they give all the content in the paragraph type. So you what you are doing is you are reading the books, trying to take out trying to take out the important points, which is a strenuous like it's a less yielding and kind of a arduous task to do. And the thing is, and it is wasteful also, because the thing is that Marrow and Dams have already done that for you. They have already taken out the important points which you need to know for your PG entrance point of view in their notes. And like from my experience onwards, I can tell you that I have not read a single word of Bailey or Harrison for my PG entrance and for my university both. So I'd say that rather than wasting your time reading those books from PG point of view, you should try to in that same time you can read the whole Dams on Marrow notes like twice or thrice. So like go for notes over textbooks.
Thank you so much. Does anyone does anybody else have any questions? Both in the meeting as well as on the YouTube live stream. Please feel free to ask any relevant questions you have, because we received a good number of questions through the Google form. So if you have missed anything, please feel free to ask, so that uh, this webinar is beneficial for you as well as others in true sense. There was one question in the Google Forms which I think it's different from the questions asked till now. So I'll just ask it here. Sometimes things don't go as planned even when you study very well. How do you bounce back from that state, and what mindset you need to keep on grinding, irrespective of the results?
So basic, yeah. So like nice question. So even I saw that question. So
Yeah.
basically,
And similarly, there is one question on similar lines of the question says how to stop comparison and negativity. So, if possible, could you just answer this set of questions?
yeah. So like the first thing you told about like how to like deal with the downs of your preparation. So what I believe is something known as the growth mindset is that either you succeed or either you learn. So if you are doing well, you succeed. That's a plus point. And if you're not doing well, you look at your mistakes. You see how you can do better, and then you learn from them. So even though you are not doing well, or even though there's like a grand test where you did, you got less marks or your rank dropped, you see what mistakes you have made in that grand test. Was it a mistake of the mind? Was it a problem in your mindset, or was it a problem in your in your thought process, or was it a problem in your pacing, or was it a problem in your knowledge base? And try to improve that. So I'd say like rather than thinking of results in the as positive or negative, think them as neutral. If it is good, then it's good. If it is bad, then you can learn from it. And about comparison, secondly, what I feel that at this point of going for the PG entrance exams, I think comparison is useless because it's at the point your paths as with respect to the other person will diverge. Like if you are comparing with with the topper of your batch, he wants to take some others. It is not that he will take the take the same specialty or the same seat as you. So basically, what I think you should do at this point is not to compare with others, because again, like their parts are going to be different as compared to you. And instead of spending time and energy comparing with them, you spend more time and energy on focusing on your own weak points and how to uh, rectify them and how to grow. So like that would be my advice on these topics.
Thank you so much. Uh, Rohini is asking in the chat box that when should we start attempting grand tests? I guess this was answered in the presentation, but still, if you could please repeat it for Rohini and others who missed.
Yeah. So what I'll do is that I'll go back to the slide. So like coming back to that slide, basically the thing is uh, you can start giving dry tests from the first day of your preparation itself, but your approach should be different. If you are giving it in the initial parts of your prep, you go with the learner approach, where you go with the mindset, okay, I will give the grand test with the knowledge, even though it might be little, I'll give it with the knowledge I have. And then I'll see all the questions and try to be sure of all the concepts. So if you have like 200 questions, irrespective of how many you have tried, you try to strengthen these 200 concepts. So next time, if any one of those 200 concepts come, any one of the questions asking those 200 concepts, asking at least one, any one of the 200 concept comes in front of you, you won't get it wrong. But if you are in the final parts of your prep, for example, you have done you have read all the topics once, you were regular with studying during your MBBS exam, and now you're in your internship, and it's like the last lap for you. So in that case, I'd suggest that you go for the test taker approach, which I've discussed. So like her question was, can I give it even if I am in the initial part of a prep? My answer is yes, but have a different approach as compared to the usual approach you have while giving tests. Focus on learning from all the questions. Like that would be my answer. Hello.
Thank you so much. We'll wait for 2 more minutes to just see whether there are any more questions. And if not, we'll wind up. Just 2 more minutes. So
Yeah.
that There is one question which I missed. It is by Kshitej asking, being a second year student. By the way, we'll take this as the last question. So everyone, please know. Uh, so he's asking, being a second year student, is it like, and he means that he's just entered into the second year. So, being a second year student, is it advisable to refer to the review books for practicing MCQs, or is the Marrow question bank sufficient for it?
Like again, as I said in my PPT in second year, your main focus should be to build concepts. But again, you can start start solving questions. But the only downside is that every 3 years there's a little uh, alteration in the pattern of the question. So what my seniors used to say that if you are going for entrance exam, always do the questions of always start when you start preparing, do the questions of the papers which have been taken 3 years before. So if you are solving questions just for your concepts and knowledge, you can do it. But again, let me give you a disclaimer that the pattern of these questions and the topics on which they are asked might not be the topics which will be there for your final exam. So you can do it, but please keep in mind that it won't be helpful for your exam. If you are doing it, do it for building your knowledge base. Like, that would be my advice on using QBank in second year.
Thank you so much for answering this question. And with this, we'll stop taking the questions. Uh, I thank Dr. Nehar so much for accepting the invitation and then giving his precious time and efforts for the coordination with me, for preparing for this webinar, for putting so much efforts in making the PPT, and finally like giving his precious time for this like today for this webinar. We just really can't thank you enough. And from the behalf of the audience as well, I thank you. I also thank all the audience for your kind cooperation and for attending this webinar in huge numbers. I apologize for the inconvenience caused due to the platform issues. However, I think the uh, webinar today went well. Uh, with uh, with this, I and lastly, I'll also share a feedback form for you all on the Telegram group. I request you to fill the form so that it helps me to revise my strategies for the further webinars. Again, thank you so much, everyone. And with this, I declare that this webinar comes to an end.